Since more and more patients with heavily pretreated myeloma receive now bispecific antibodies, they need to go through this step-up dosing phase. And in many countries around the globe, patients are still hospitalized during this step-up dosing. And this can last for 7 to 10 days. And of course, this puts a lot of stress on the healthcare systems. So what we did basically is to try to explore to what extent remote patient monitoring could allow us to send patients home after the step-up dosing. Because with bispecific antibodies targeting BCMA GPRC5D, 50 to 70% of the patients will develop CRS. And although mild or moderate, you want to pick it up early and you don't want it to be severe. So what we did in 20 patients who received a bispecific antibody in our institute, all patients were hospitalized during the step-up dosing and they underwent routine clinical standard of care. But in parallel and independently, we used remote patient monitoring through wearables, where we measured temperature, where we measured the heart rate, respiratory rate, and other variables. And our major conclusions from this pilot study was that through this remote patient monitoring or RPM technology, we could pick up CRS significantly earlier than during routine clinical practice. We picked up an increase in temperature on average 4 to 4.5 hours earlier than with the standard routine clinical care. Other parameters like the respiratory rate or heart rate variability, they were not predictive for early CRS detection. So this study now will be followed by the next phase, where we will send the patients home through the RPM, with the RPM system, and therefore we believe that also building a flow to make sure that patients who need to come to the hospital can be there rapidly, we believe that it is a safe approach in the near future. Thanks for your attention.